Teledentistry, what is it? Go to teledentistry.operadds.com to find out how you can completely change how we bring in new patients, giving them the ability to send photos and video before you ever talk to them. Go to teledentistry.operadds.com. Welcome to the Operatory Podcast, the podcast about burying the dinosaurs in dentistry, moving past outdated technology and procedures to find a better way. With me today, providing the patient perspective, as always, is my man, David Pryor. How are you doing, sir?
Good, Brian. How are you?
I am doing well. Thank you. Thank you, sir, for asking. I have today, I want to talk about a topic that we've talked about in the past, but I want to get more sort of granular with it.
Okay.
It is about nervous patients, anxious people.
Okay.
And as we talked before on this podcast, you aren't necessarily one of those people.
I am not.
No, but you are a patient and you have a perspective from your side. I would like to ask you, what do you think the dentist's perspective is of anxious people?
Well, I can say what you've said in the past.
Go ahead.
Oh, get over it, you big baby.
Oh, thanks. Thanks, man. Yeah, that's like one of those times when you're like, not my best parenting moment,
No.
right? When I could have handled that differently.
but you know, as you've grown over your career,
Yes.
you have developed much more empathy for those anxious patients. But I imagine it's stressful for the doctor as well.
No, great point. Yeah. You're right. There's no doubt that how I view anxious patients has completely, fundamentally changed. Not just over the course of my career, that's giving me too much credit, over the course of the last few years, really. Mm-hmm. Since I went to a lecture and we started developing virtual reality, and before that, you're right. It was like, oh, how can I just make this person not a pain in my ass, right?
Yeah.
I mean, that's really what it is.
For sure.
Right? And I don't think that's unusual.
Oh, no.
Right? No. Because we're looking at it from our perspective. And I think that, that's one of the reasons why we started this podcast, because I was like, man, we need to get a patient's perspective on things, because I missed that for at least the first half of my career.
Well,
at least.
That's the hardest thing, when I'm talking to people about virtual reality. That is the biggest barrier for me to get past when talking to doctors about it. They don't feel that patient's pain. They have their own painful experience looking at the patient being in pain, but they don't have any sort of concept. They need to take not one step, but two steps back to really look at what's going on. How freaked out is this person? And can you get in their head and go, oh yeah, this is a big deal. And anything we can do to take that anxiety down is going to be big and impactful.
Well, 100%. And here's why. Okay, this was the point of this podcast I want to have. Is I've got the 4 reasons that anxious patients are your best patients. Most dentists, I think, not consciously, but subconsciously, and certainly practically, when they're in the practice every day, aren't looking at that anxious patient going, this person is my best patient, right?
I have this discussion with them.
Okay.
Like when I'm talking about VR. And I always say this, it is that your most anxious patients are also the ones that will give you either the most praise or they're the loudest voice in your practice.
Okay.
And so they're going to bring you the most patients because they are that's how they're wired, is to talk about their anxiety and anxiousness. And so if you can be the one to overcome that, done.
Yeah, that's one of my 4 points.
Okay.
So thanks, Dave. So number 1 of the 4 reasons why anxious patients are your best patients is because they're your best salespeople.
Yes.
If you can actually address people's anxiety and treat them well, they become, as just like you eloquently said, they're their number 1 source of word of mouth, right?
Yep.
And I've been on the news with a patient
Yeah.
talking about how virtual reality transformed her life, right?
Yep.
And that's because she has anxiety, dental anxiety. And so I mean, you think that helps my practice?
Yeah.
Absolutely. Right. And so you're right. That's number one is that anxious patients, not people, because we're doing what we do is weird. It's not weird for us because we're there every day, but for the patient getting work done, it's weird. And, I still to this day, if I go in and there's something, I know that this filling, if you just shut up and open your mouth, it's going to take me 30 seconds. Right.
Yeah.
But you're crying. Well, you've never had a filling before. You have no idea what to expect. There's all sorts of anxiety. Why is that weird why do I think that that the patient's the problem sometimes, right?
Right, yeah.
Intrinsically. Flip the script. They're your best patients. That
Right.
patient's going to be your best salesperson, number one.
Yep.
Number two, okay, not only are they best salespeople, but people with anxiety don't go to the dentist very often, right?
Yeah.
So usually they have a lot of work to do. So,
Yeah.
we don't do all on fours on patients that come every 6 months,
Yeah.
right? Very irregularly. We see people with anxiety who have neglected their care. And not only will that person on the back end be your best salesperson, but they're going to be your best production today,
Yep.
right?
Yep.
Doing a buccal pit isn't as productive as doing an extraction and implants. That's the reality. And so if you have the reputation of treating people with anxiety and you get that patient that hasn't been in for 10 years into your practice, chances are you're going to produce more, period. Okay, so that's number two.
Okay.
Number three, how often if somebody has lots of anxiety and you help treat their anxiety in dentistry, where are they going to go? Right?
Right. Well, I'll tell you where they'll go. Nowhere. And then their teeth are going to fall out of their head.
I'm experiencing that every day in my practice right now because I am cutting back my clinical hours based on all the stuff going on with technology, and I'm still seeing patients. So patients are looking at me going, "Where do I go?" They're like I'm like, oh my gosh, they literally would do anything. I mean, they're like begging me to see them. And it's not because I'm so great. It's because I address their anxiety. That's 100% what it is.
Yeah.
Makes sense?
Yeah.
So not only are they your best referrers, they're your best production, but then they're also your best recurring source,
Yeah.
which, I mean, like, how aren't those the best patients, right?
Right.
But there's one more thing.
Gasp.
Are you ready?
Yes.
They're the most numerous. There's a lot of them. 80% of adults in the United States have dental anxiety. So if you want to specialize your practice to 20% of the people, right? Advertise that you don't treat anxiety. If, however, you want to capture more people, right? 22% of people have put off dental treatment because of anxiety. And so if you're going after humans with teeth, right? You should probably treat the most pervasive condition that they have coming in. There's probably, I don't know what the percentage of patients coming in that have dental work to do. I mean, everybody has to get their teeth cleaned, right? But dental anxiety has got to be the biggest pervasive endemic with dental patients. So if you can treat them, you'll be seeing more people.
Right.
So you'll see more people more often that won't leave and doing more production. So are those 4 good reasons to sort of change your mindset around anxious patients, being your best patients?
Absolutely.
That's it. I mean, that's really what I wanted to get to with this podcast. I sat back and thought about him going, every day going to the practice, thinking about seeing that anxious patient, it brings up anxiety in me. When in actuality, that's an opportunity, not a problem. Seeing anxious people.
As a salesperson, that's always what you're looking for, is where is the friction that you can help alleviate. And that's your biggest opportunity as a salesperson. If I call in an office and they don't have any problems to solve, well, I'm not going to sell them anything. And the same for you as a dentist. If you can solve their problem of dental anxiety, which they're walking in there, that's their first thing before you ever look at their teeth. If you can address that immediately, that is going to be a big, big deal for that patient. And just like I've said, those people that are the most anxious have the loudest voices. And so it can go either way for you. You've got an opportunity to win them over, or you've got an opportunity for them to be deadly afraid. It's going to be, it's a double-edged sword.
That's a very good point.
Yep.
That they're also going to be most actively saying negative things.
Right.
Like those are the 1-star review patients for sure, right?
Yep.
Well, so great point. And so here, just quickly, because I've gone over this before, and we'll likely go over them in a podcast coming soon. I want to go over, just because there's probably dentists out there, if you agree with me, right, that about if you coming into the podcast maybe didn't view anxious patients as your best opportunity, but you do now. Here's 5 things that you can do that I'll just list quickly to help get over this, and we'll dig deeper later on. Number 1 is provide same-day service. Anxious people, when you tell them they have something to do, they're going to be anxious about it and then go home. So if you take care of it now, you've squashed a bunch of anxiety, right?
Yep.
Number 2, same-day appointments. When people call in with something, you should get them in right away, right? And although number 1 and number 2, the guarantee at my practice is same day. Yep. That's why. Same-day service, same-day appointing. So we just cut down to whatever you want. We'll do it today. Teledentistry triaging and teledentistry consults. We've got podcasts about those, but giving people who have anxiety a way to safely come into your practice, both with large cases and with emergencies, huge. And VR, of course, right? So transforming the patient experience through virtual reality, which acts more effective than nitrous oxide in most cases, but no drugs. So those are the 5 strategies that I would recommend to capture the reasons why anxious patients are our best patients. So again, the 4 reasons: they come in more frequently, they have more to do. As you stated very eloquently, Dave, they refer more people, right? And they're the most common patient too, right? And then the 5 strategies to overcome it: same-day service, providing same-day appointments, emergency teledentistry triaging, doing your consults through teledentistry, and virtual reality. Thanks, Dave.
Awesome.
I also want to remind you to rate and review us wherever you're listening to this podcast. If you have suggestions or comments, please visit theoperatory.com and drop us a line. Again, I'm Dr. Bryan Laskin, host of The Operatory. Thanks for listening. I look forward to speaking with you next week.